All right, we should be good now.
Welcome, and thank you all for joining us for our September the 29th update of COVID across the Lake Cumberland District. We have some members of the executive team that will be answering some questions or the questions that we received over the past 2 weeks. Amy Tomlinson, our executive director, is going to give us an overview of COVID-19 since our last update.
Thank you, Tracy. I'm going to try to share my screen and give you all a situation update. Just give me 1 second to get this worked out. Okay, hopefully, are you all seeing the case summary? Okay, so this is our, as of last night, this is our total number of cases across our 10-county district. You can see that our current active cases for the district is 1,043. That is still higher than we want to see it, but it is actually down slightly from where we have been previously. So we are very, very hopeful that this is the beginning of a downturn of cases in our area. I think it's still too early to confirm it, to say that with complete confidence, but it is looking like this may be a downturn. So that is good news. We are starting to see maybe some relief. I will say that our hospitalizations, you can see here, we're reporting 54. That number is actually always low because we just have a hard time keeping on top of it with the way people that come in and out, discharged and et cetera. So that number is usually low on our end as to what is actually reflected across our hospitals. So anecdotally, when I talk to hospitals or when I hear from them, they are still telling me that they are pretty much at capacity. They are still full. And we are still seeing some problems there across our 10 counties. Our deaths are sitting at 608 total deaths across our 10 counties for the entire duration of the pandemic. Those are still considerably going up, and that is to be expected. As we see a spike in cases, generally speaking, hospitalizations and deaths do rise following that spike in cases. And sometimes that is delayed by 2 to 4 weeks. So it trails just slightly from the highest number of cases. So we are still expecting to see more deaths and hospitalizations in the coming weeks, but we are extremely hopeful that those will start declining as well. So you can see that as of last night, we reported 364 cases. That's about where we have been for the last couple of weeks or so, in the 300 to 350-ish range of cases. Our Mondays are usually a little bit higher because of the influx from the weekend and just trying to catch up from Saturday and Sunday over the weekend stuff. So we are averaging between 300 and 350 cases a day across our 10 counties. We are still, let me scroll down and I'll show you, all of our counties are still in the red zone, but they are decreasing. The transmission rates, the incidence rates here. When you hover over a county on our webpage, it will show you what the incidence rate is per 100,000. Those are starting to go down in most of our counties. So it is a somewhat good sign, that we're heading this direction, and we're hopeful that this will continue. I want to sort of add a word of caution to this because I know that next week and the week following are fall break for a lot of our school districts, and we have some people that will be traveling and whatnot. So we do want to suggest that, to have a vaccine. Of course, that's not going to protect you necessarily for travel next week, but we do want to promote vaccination, and then also to take all the necessary precautions about social distancing when you can, hand hygiene, washing your hands frequently, covering your cough, those types of things, masking when you're in large crowds that are not your normal circle of people. So that's where we're at currently. Thank you, Tracy.
Thank you, Amy. I'm going to move on to the questions now. Question 1 is for you, Dr. Wayman. Is there a specific antibody level at which someone is considered to have an adequate immunity, and do lab tests differentiate between antibodies developed from having the virus and those from the vaccine? And you're muted, Dr. Wayman.
Yes, there are antibody tests that can differentiate between infection and vaccine. The nucleocapsid antibody is positive after infection, and there is a test called the semi-quantitative total spike antibody that is positive after vaccination. At this time, we don't know the minimal level of antibodies that can protect you from disease. However, we do know that the higher the antibody level, the better the protection. You're muted.
Thank you, Dr. Wayman. I'm sorry. Next question. My son's teacher evidently had COVID last week, and when he returned to school this week, the teacher shared that he had been positive with the students. Do you know what the protocol for school notification of positive cases are? I'm not sure who wants to answer that.
I can answer that. The school are doing their own contact tracing, or they're doing that with our assistants. If the children had been considered a contact, which would have meant that they were masked within 3 feet or less, then the school should have notified the parents of that. If you have specific questions about the school's policies, because some of those vary somewhat from school to school, then anyone should reach out to that particular school.
Thank you, Laura. The next question, and this is a final question. I should have said this a few minutes ago. If anyone watching has questions, if you want to type those in the chat box, we'll answer those following this question. Is coughing up blood when you have COVID something common?
No, coughing up blood is not a common symptom. However, people who are severely ill and are admitted to hospital and have pneumonia may have blood-stained sputum.
Thank you, Dr. Wayman. And I am not sure if there's any questions in the Zoom chat or there's no questions there. Okay. Do Dr. Wayman, Laura, Amy, do you all have any other things you want to share today on the Zoom?
We wanted to let everybody know about the current booster dosing. The CDC and FDA have approved only one vaccine currently to be boosted, and that is the Pfizer vaccine. So certain groups of individuals who had the Pfizer vaccine can now receive the booster dose. I think we're going to see who these folks are. So it's basically people over 65, residents of long-term care, people who are 50 to 64 with certain underlying medical conditions, and people who may be at high risk of severe COVID due to their underlying conditions over the age of 18, and also people who work in situations where they may be exposed, such as healthcare workers. Do you ladies have anything to add?
Maybe we should mention that it needs to be 6 months after your second Pfizer vaccine.
Thank you. Yes, at least 6 months, yes.
Right.
And the health department is now providing the Pfizer boosters, as probably many of the pharmacies.
So if a person like myself, I've had Moderna vaccine. If that's the case and a person has had Moderna, they just need to, at this point in time, wait on their boost dose. It's the only one that's been federally approved and recommended for a booster dose is the Pfizer, correct?
Correct. Now, the other two have already asked for authorization, but it has not come through yet. I would think it'll be just a matter of a few weeks.
Okay. And this is different. This dose is different than the recommended dose for the immunocompromised that we talked about a few weeks ago. I think I mean, it may be the same dosage of vaccine, but it's a different set of population that's eligible for that, correct? The immunocompromised can still get their vaccine, and that is for Moderna, Johnson & Johnson, or Pfizer, correct? No?
Correct.
No, just the mRNA vaccines, which
Not
is
Johnson &
Pfizer and
Johnson.
Moderna.
Okay, so not the Johnson & Johnson.
Correct.
Okay.
Right.
Okay. It changes so frequently. That's why I need to keep you all on here to keep me straight.
And us.
Hey, thank you all for sharing that. Is there any other information you want to share today?
Just the normal things. And hopefully, like I said, this hopefully is the trend that we are starting to see a downward turn in some of this. As far as some of the things that we've talked about in the past, the EMS strike team that I think we mentioned a few weeks ago when we talked with our hospital partners and EMS, that there was a team that had came into the region to assist with transfers. That team had originally been assigned here in our counties for 1 month. And I heard this morning that that has been extended through the end of October, or through roughly the end of October. So it has been extended. So that is another resource that's available to help with the burden on our EMS and hospital situations. I do know that some of the National Guard units that have been deployed across the state are actually in some of our hospitals. We have National Guard helping in Lake Cumberland Regional Hospital. I think Taylor Regional Hospital has a team, and I'm missing another one. I think there's 3 teams maybe across our 10 counties. I apologize if I'm missing it. I think there's going to be one assigned at Russell County Hospital, is what I've heard. By the end of this week, they should be getting some help there. And then there has also been an infusion team that has been assigned to Taylor Regional Hospital that should be in place. I think if they're not already in place, it should be here this week also. So we have lots of support coming into the region to help with some of this, the demand that's on our healthcare staff right now, and that's much appreciated.
Thank you for sharing the update, Amy. Laura, Dr. Wayman, any final comments, thoughts?
They're vaccinated.
And our numbers are slightly going up across the district, I've noticed on our reports, so that's a good thing.
Numbers are going down.
Or going down, I'm sorry, yes.
Yeah.
Numbers are going down, but vaccination rates are increasing as well.
That is true. Vaccination rates have increased, and that is definitely a good thing.
Yes. All right, well, if there's no questions in the comments, I just want to say thank you all for joining us today. I want to remind you that we do put out daily reports Monday through Friday, and those are posted on our website as well as our social media. And we will have our next community update Wednesday, October the 12th at 2 o'clock. Thank you.
Thank you all.